Good afternoon. I am honored to be presenting at this year's conference. My name is Natalie Perez Mendez. I am a medical student at Poznan University of Medical Sciences, and my co-author is Dr. Martha Rodriguez, internist and president of MMR Healthcare. Our presentation is a case report entitled Uncommon Consequences of SARS-CoV-2 on the Nervous System. This is a case of a 52-year-old Hispanic female presenting to our outpatient private internal medicine practice with no prior history of nervous system pathology. Her primary televisit was May 2020, where she presented with a severe respiratory infection and subsequently tested positive for SARS-CoV-2. She required a thorough course of steroids and eventually required continuous supplemental high-flow oxygen for a total of 8 weeks. Her secondary visit was July 2020, which at this point she tested negative twice for the virus. However, she continued to complain of severe muscle aches, sciatica-like pain radiating down both lower extremities, nerve impingement pain starting at the neck, radiating down both upper extremities, intermittent amnesia, chronic fatigue, and hair loss. All of this was refractory to NSAIDs and topical diclofenac. The doctor at this point decided to try B12 injection. And with the cyanocobalamin 1,000 micrograms IM injection, it did help the patient and most of her symptoms were resolved. However, a few days later, the symptoms returned and she continued to complain of the same symptoms and of the same severity. So before moving on to more invasive options, the doctor decided to try the B12 injection once again. And these pictures show some of the skin manifestations that appear if the patient goes a few days without that B12 injection. To this day, the patient still suffers from the aforementioned symptoms, and she still requires this cyclical therapeutic injection of cyanocobalamin. There is evidence to support that this virus does invade the nervous system. This graphic illustrates neuronal injury associated with SARS-CoV-2 infection. Whether the virus takes a path via the olfactory pathway or by crossing the blood-brain barrier directly, it appears to trigger a cytokine-mediated destruction cascade that is most likely playing a role in our patient and many others like her, and unfortunately causing long-lasting consequences. I'll conclude with the primary takeaway from this case and some questions we think are important to find the answers to. Our research asks if regular B12 injections can be a viable therapeutic for patients suffering from a similar COVID sequela like our patient. The upside is that it is relatively cheap, readily available, and a water-soluble vitamin that can be administered easily in the outpatient setting. A lot of the policy being put into action regarding how to deal with this pandemic has been guided by data from hospitalizations because of how expensive it is to care for hospitalized patients, and because, of course, morbidity and mortality increases as a hospitalized patient. Therefore, focusing on efforts on outpatient therapeutics has positive medical and political advantages, I think, that we should consider. We must also ask if the placebo effect is at play here with this patient. We argue probably not, because we know that severe B12 deficiency causes irreversible peripheral neuropathy that may lead to paralysis. So we know that there is a definitive link between the well-being of the nervous system and vitamin B12 levels. And finally, what is the optimal timing of these B12 therapeutic injections if it is found to truly be an effective treatment for this patient population? Would it be better to begin the B12 injections at the time of the COVID-19 diagnosis instead of 2 or 3 months later? Should patients with known COVID exposure begin prophylactic B12 supplementation right away? A thoughtfully designed study with an N greater than 1 would definitely be useful in answering these questions. The scientific community has made enormous gains since the start of this global pandemic, and I am hopeful that we will continue to illuminate important aspects of the disease that will help patients like the one I presented today to provide better therapeutics and a chance to return to pre-COVID-19 life. But there is still much work to be done. And with that, I want to thank you all for your attention, and please contact me with any questions you may have.